Welcome back. Now, a special campaign, Vaccinate India, in partnership with Google. We're discussing questions that many of you have about vaccines and about COVID, and questions that you often look up online or Google. And we're joined by Dr. Vedam Ramprasad, the scientist, CEO of MedGenome. Thank you so much for joining us. And, one of the questions that is looked up very often is about, preventing COVID. People look up, how can I prevent COVID? So what would you say to that?
Thanks, Gagi, for having me. So preventing COVID, the best way is ensure that there's enough social distance is maintained and you don't go to closer to the individuals, wear masks. These are the best preventive measures at this point of time. And as far as possible, whenever you get a chance, how quick you get a chance, you vaccinate yourself as per the ICMR guidelines.
That's right. Vaccinating is one of the, the best ways for us to prevent COVID and also end the pandemic, because we need to have a coverage of, a huge proportion of the population, isn't it? So that the pandemic can finally end. If you could just explain that.
Come again, Gagi.
About how we need to, get what we refer to as herd immunity, and how we need to vaccinate a huge proportion of the population. And that's the only way we'll, find our way out of this pandemic.
Yes, that's right. So everybody has to be responsible. Government is doing its best efforts. The production of vaccines is increasing. So either go to nearby PHC or ensure that you go to a private center if you can afford, get the payment done and get vaccinated as quickly as possible.
Right, Dr. Vedam, there's also the variants that have emerged. The Delta variant we know is more infectious. We don't know if it causes more severe disease. And if we talk about, preventing COVID and vaccines, there is some amount of worry about breakthrough infections or how effective these vaccines are against the variant. If you could, tell our viewers about that.
Yes, that's a very important question, especially for all the viewers who are not deep into the science. The Delta variant is a little bit worrying at this point of time because it has two mutations. It has a host of mutations, this particular virus strain, but two concerning mutations, E8484K and L452R. These two mutations, we call them as escape mutations, and they come because of the evolution that virus happens over a period of time. And due to selective pressure, the virus evolves, try to gain entry into more cells and survive itself. So different types of mutations come up. Majority of the mutations don't do anything. They either even sometimes reduce the infectivity or pathogenicity of the virus. But a minority of the mutations, like these two mutations which I've told, they increase the infectivity, they increase sometimes even the virulence. And most important is the Delta variant has been shown, proven by deep mutational scanning and few other analysis that one, it increases the infectivity by about 40%. Second, this is an escape strain or escape mutation, evades or helps the virus evade the either vaccine-induced antibodies or monoclonal antibodies that are given as a part of the drug regime. So you will see some individuals, a percentage of individuals, even after 2 doses of vaccination, even after generating enough antibodies, they still get COVID, although it will be mild to moderate but not severe.
Right, and that's the important point to emphasize as well. Also, another question that gets looked up a lot is self-care during COVID.
Sorry?
Self-care during COVID. How do you take care of yourself when you're ill with COVID, if you could tell us?
Oh, first and foremost, get isolated. Don't go out to your house. Second, depending upon the severity of it, if it's going to be moderate or severe, immediately call the hospital, get admitted in the hospital, follow the protocols given by the clinician, especially when you are above the age of 45 and you have a comorbidity or you have any other disorder. Get admitted in the hospital, follow strictly the guidelines given by the clinicians, hospitals and doctors, and also ICMR, and ensure that you take sufficient care of yourself with the drug regime that has been given. Do not venture outside the house or the hospital.
Absolutely. Thank you so much, Dr. Vedam Ramprasad, for joining us on the program.
Yeah, thank you.
Well, let's